Patient comes in to see me complaining of severe low back pain that's shooting down their leg. Now, sometimes this can be related to something really simple, like they were just picking up clothes off the floor or rolled over funny in bed, or sometimes it's more serious, like they were picking up a really heavy box and immediately felt a pop in their back. The pain is debilitating and it's been going on for several weeks. So when I hear this story, I'm immediately thinking that the patient has lumbar radiculopathy or irritation of a nerve in their low back or lumbar spine. And I'm going to go over some of the most common reasons for that. The first cause is a bulging or herniated disc. So you can see here, as the disc starts to push out, it creates pressure on this little hole in the spine that the nerve is coming out of at each level. As the nerve gets more pressure, it can first start to send pain signals, then you may not start to notice numbness or even weakness. Down here are examples of our degenerative disc disease. This is another really common reason when we can see lumbar radiculopathy. Now, these are more chronic issues. So you can see here, as the disc degenerates, that little hole that the nerve comes out of is getting smaller and smaller. So this puts chronic pressure on the nerve. So these are patients where typically the symptoms can come and go, but they usually continue to progress over time. This MRI shows an example of lumbar spondylolisthesis, which means one vertebra is slipping forward on another. So you can see in this picture that L5 vertebra is slipping forward on the sacral vertebra, and that puts pressure on the nerves. Now, this can be due to congenital issues where you're just born this way. It can be traumatic, meaning there was some sort of accident that caused it, or it can be degenerative, so just age-related. And this MRI shows an example of lumbar stenosis. So in this case, you can see this is the back part of the spine here, and then in front of that is the spinal canal. The white part that you see is the fluid that bathed the nerves, the CSF. The dark part is the actual nerves coming down in the spine. So you can see here, there's pressure on the nerves because of a herniated disc. So lumbar stenosis can happen for a lot of different reasons. Sometimes it's a herniated disc. Sometimes, again, it's just osteoarthritis. It's bone buildup in the spine with age. And as these things start to happen, you get more pressure on the nerves, and that can also cause lumbar radiculopathy. So these are just some of the more common reasons that I see lumbar radiculopathy in my clinic, but there's some more rare reasons too that I won't go over in this video. The cause and the severity of your lumbar radiculopathy help us know what treatment you would best respond to. If it's an acute new problem and it's just related to pain and you're not having weakness, then you may respond better to physical therapy, medications, or injections. Versus if it's a chronic problem or if you have weakness, then you may need a surgical procedure to fix your problem. And as always, I'm happy to answer questions.